The more I researched, the more I learned, I actually got very interested in this field.
Wow, so you went from a PhD graduate to a stay-at-home mom to now a full-fledged business owner. I'm sure a lot of GPs would be able to resonate because starting a clinic is not like just seeing patients. It is about building a business.
So, compounding pharmacy, whether it's an allergy-free ingredients or a different dosage form, compounding pharmacy can actually create that for you. One of our doctors who came with a case study of a patient where he was taking around 14 different type of medication in a day, which compressed 14 tablets into 4 tablets. Doctors, when they talk about hormones, they're like, oh, sorry, I'm not very familiar with hormones, so they don't want to touch the topic. GP can actually enhance patient outcome, expand their treatment options, and also differentiate their practice.
Join Disruptive Doctors.
I'm Dr. Selena, your host and co-founder of Disruptive Doctors. At Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. In Post Call, we dive into the untold stories of doctors who are breaking the mold, trailblazers who are redefining what it means to be a doctor. This is Post Call Beyond the White Coat.
How compounded medication can improve a patient's outcome. Welcome to the GP Series podcast by Disruptive Doctors. I'm Dr. Selena, your host and co-founder of Disruptive Doctors. Now, today's episode is sponsored by PharmaMedica. PharmaMedica is a compounding pharmacy that offers personalized health solution. And we have Kamini, the founder of PharmaMedica, here with us to share insights on how GPs and clinic owners can improve their patients' outcome through compounded medication. Hi, Kamini.
Hi, Selena. Thank you. Thank you so much for having me on this podcast.
Okay, maybe before we talk about the practical stuff, what did you like tell us a little bit about PharmaMedica yourself? How did you came about to start this business? I mean, what inspired it?
Okay, so just a little sharing on my personal journey. I graduated with a PhD in biomedical science from Monash University in 2017. So while I was graduating, I was actually pregnant with my first child. So I decided to take a break and stay at home and concentrate more on my family life and, taking care of my kid. After my kid was born, I wanted to go and try something else. I wanted to go into the teaching line actually. So I went and I went around applying for lecturing jobs, but nothing came about because I think most of them said like my field of study was very saturated and the competition was very high. So it kind of pulled me down a bit and then I felt very depressed. I was very demotivated at the time. So, and to make things worse, COVID happened at that time. And so all of us was, locked in the lockdown. So time went by and I tried to occupy myself by doing baking and cooking and things like that. And then, after that, I was pregnant with my second child and things were a bit more different then because the travel restriction was lifted and then my parents could actually come over to help me with the kid. And so that time I felt like, I wanted to go out and build my career. But at the same time, I felt like I wanted something more flexible where I could actually be with my kid and also build my career at the same time. So that's the time where my husband, who was a GP at that time, he was already doing a compounded medication. So he kind of told me like, since it's very related to what I've done in my research, why don't I, go into compounding, explore a little about that. So I started exploring, I started talking to a lot of people. I went on joining a lot of courses and then I even went into joining the functional medicine courses where they spoke a lot about supplementation and BHRT. So the more I researched, the more I learned, I actually got very interested in this field. So instantly I knew that this is what I wanted to do. So I started off firstly by, securing my finances. Thankfully, my husband was there to help me with the finances and also had my own savings. And then I found a suitable location and then I went on building my team and then the necessary licensing and documentation. So everything took about like 6 months. And then 6 months later, I set up my business, and then Pharma Medica was born.
Wow. So you went from a PhD graduate to a stay-at-home mom to
Correct.
now a full-fledged business owner.
Yep, it was a really long journey, I would say.
Okay. I mean, before we go in further in that, I guess I'm also curious, interested to know how's the journey so far as an entrepreneur and as a business owner right now?
It kind of get easier because when I started off the business, it was really a lot of struggle. It was a lot of challenges. There was a lot of struggle because I didn't come from a business background, and then that was, Pharma Medica is my first business.
Which year was that?
I set up Pharma Medica in 2021. Yeah, so at that time it was very difficult. There was times where I would feel so demotivated and always question myself, is this something that feasible? Because there's a lot of stress involved, I invested a lot of money and then my time, and also at the same time I had two small kids to look after. So it was really a struggle at that time. And then also building the team, I brought different people, and managing people isn't that easy. That's like the biggest struggle, and then maintaining or sustaining the business will also another struggle. So there's a lot of struggle along the way, but compared to that 5 years, that was like 5 years ago, right? So now things are very much easier, very much because it's all like auto run, and I have that constant team who knows the flow and everything. So things are very much easier now, actually.
Where did you learn how to build and run a business?
Honestly, I did a lot of reading, and then I also spoke to a lot of people, and mainly it's from my husband who was also running his own business. So we used to sit down and talk about how to run the business, what kind of aspects that I need. And then, a lot of things we can't do ourselves because it's a huge business that involves a lot of maintenance, a lot of managerial skills. So I started hiring people to manage a certain aspect, like the accounts part and the HR part. So that's my husband was the only one that I could actually speak to at that time because he was already running a business himself for the longest time.
Okay, so now let's talk about the practical side. I mean, that story of you getting into business, I think that was, um, I'm sure a lot of GPs would be able to resonate because starting a clinic, it's not like just seeing patients. It is about building a business. So I'm sure a lot of them may be able to learn something from what you've just shared. Okay, so now let's talk about the compounded medication. How is it different from drugs that doctors, like those commercially available drugs that doctors can get directly from companies like Zulik Pharma, Novartis, and the likes of those? Like, what is the difference in that?
Okay, so compounding pharmacy, actually what we do is we create customized medication based on doctor's prescription, mainly to cater to individuals' specific preference. So whether it's an allergy-free ingredients or a different dosage form, compounding pharmacy can actually create that for you. So what you are saying just now, the medication, which are all mainly the registered drug that you can actually buy over the counter. So those are all made for the mass, right? They're manufactured in large amounts and it's made for the mass. So anyone can take it because the dosages are controlled, and then it comes in one dosage form. And then you also have the hologram, the registered KKM registered number, the MAL number, and all that. So that one does not really need to go under a doctor's prescription. So compounding is very different. We only process the order if doctor prescribes the medication because we can actually alter the dosage form. Like for example, patient who come in who cannot swallow tablets or capsules, right? So compounding pharmacy can actually change the dosage maybe to a liquid or a powder form. That's something easier for the patient to consume. So this is what makes us different from the medicine over the counter. And also the part where we do not add any preservative. Compounding, usually we do not add any preservative. So if you're going to ask for a specific ingredient, the whole capsule is just going to be the active compound and not the any preservative added into it. Whereas the ones over the counter, they usually add a lot of preservative because it needs to, be on the counter for at least 1 to 2 years. The shelf life is that long. The compounded medication usually is only like 6 months.
Okay, so that means how will the doctor know like what are the things that requires in the drug? Can you give like an example? Something say like metformin. I'm treating a patient with diabetes and he needs metformin, maybe glucoside, and a couple more drugs. How is it that if I'm buying something from, say, like I order from Zulik, right? And then I just get all these drugs and I come to you as a compounding pharmacy and you're giving me a compounded medication, how is this different? Like what would you be doing differently?
So compounding pharmacy, we're not allowed to actually compound those kind of drugs. So what we do is we are allowed to compound nutraceuticals and also hormones, PHRTs. So if you want drugs are different from what we are doing. So if you want drugs, then you have no choice, but you have to get it over the counter. But if you want something, an alternative to a drug, which we're now currently a lot of people are seeking for, they're looking for, supplementation or something alternative to drugs, you can actually come to compounding where we will do a formulation for you based on what the doctor requests or what the patient's concern. And we also can change the dosage form. For instance, the patient requires many kind of combination, and some, we will actually advise the patient based on the drug efficacy or the safety profile. Some of it can also be compounded into liquid or maybe into cream form. So that's what compounding does. So it's actually different from the drugs that you get over the counter.
I see. So you mentioned all this is mostly supplements or BHRT. So, as doctors, right, we in training, we only know how to prescribe the regular drugs that we the kind of patients we get. Say, for instance, diabetes. I'll only be prescribing all these kind of drugs like metformin, glucoside, and all the OHAs or antihypertensive and all that. So if I'm going to use compounded medication, what sort of knowledge do I need to know or need to gain for me to be able to use this kind of services?
Okay, so a lot of doctors come to us. Actually, this is one of the challenge that doctors face most commonly, right? Formulation guidance is something that we can always provide. So if doctors come to us and they say that they're interested in doing compounded medication, but they do not have the right knowledge to do it, we are always there, especially our pharmacist who is very well versed in formulation, always can educate the doctor on how to use a certain medication or how to do the formulation based on the patient's request. So that's one thing that we can always help you with. And then the next thing is that we can always give you some brochures on, especially when BHRT patient gets really scared when you talk about hormones, right? So even doctors, not everybody knows how to do hormones. So there are few guides that you can follow. Like in our practice, we have brochures that explains to you just in a very basic form what are the hormones involved and what are the signs and symptoms to look for before you want to prescribe hormones to your patient. So this is just an informative brochures for doctors and patients to look into. So when patients read those brochures and then they're interested, they ask the doctor. So if the doctor really wants to prescribe hormones, they can always come back to us. And we also do give trainings on certain topics that that doctors that would like to know.
So, like, can you give me a case study? Like, in what sort of situation I can use compounded medication for my patients?
Let me give you a real life story of one of our doctors who came with a case study of a patient where he was taking around 14 different type of medication in a day. So it's like 14 tablets he would have to, swallow in a day. Imagine 14 tablets in a day. I really don't know what was he putting himself into. So this doctor came to us and say because of that, so many amount of tablets that he's been taking, patient is having really bad gastric issues. So he asked if we could actually help him to minimize the number of capsules that he needs to take in a day. So upon reviewing and all that, we kind of compressed his medication. He was actually treating many symptoms, like he had BPH, he has hypothyroidism, and then he had some cholesterol issue and so many other issues that he was actually treating. So we tried to compress the 10 tablets into 4 tablets. So the 4 tablets, we also told him to take like 2 in the morning and 2 in the night. So we kind of spread out his doses. And then some of it, which like he was also taking testosterone tablets and all that, we converted them into a cream form so that it kind of improves his patient compliance as well. So that is one case that we had. And then we also had another case where a patient who was paralyzed and he needed certain ingredients and certain dosing that they couldn't find it over the counter. So the doctor came to us and asked if we could actually compound for him in a way that he can actually consume because patient was unable to swallow any tablets or pills. So what we did, we made them into powder form in where the family would actually mix it in drinks or any juices and then they could actually feed him with that. So this was the 2 examples that I could remember of.
Okay, like you mentioned hormones. Like what sort of hormones do you compound?
So we compound all the bioidentical hormones, hormones that are similar to the one produced in your body, like progesterone, estrogen, testosterone, tyrosine, uh, DHEA, all the hormones that we do have.
For a doctor to be able to prescribe all this, what are the key things that they actually have to go and learn and know about?
Mainly is like they need to educate themselves. Hormones is not something for everybody. So not everybody would actually know how to give hormones. So a lot of doctors also when we talk about hormones, they're like, oh sorry, I'm not very familiar with hormones, so they don't want to touch the topic. So in order for you to know how to prescribe hormones to your patient, you actually need to educate yourself first. Educate yourself on what are the symptoms to actually look for in patients and what kind of hormones can be given and what are the doses that are needed. So all this, if the doctors really don't know, they can always come to us and our compounding pharmacists can actually guide them through. So that's one way. And then doctors also can identify the candidates for compounding, especially in hormones. Some practices where they have a group of patients who always come to your clinic where maybe menopausal women who requires hormones. So this kind of patient that comes to your clinic, you can always create a market. You can come to us and say, we have postmenopausal women who has got a lot of menopausal symptoms. So what kind of hormones are regularly prescribed to them? So we can actually suggest something. And of course, hormones is all dependent on the doctor and the patient's symptoms. You only give hormones if the patient is showing some sort of symptoms that needs some sort of relief. So these are the way that doctors can consider before starting off any hormone therapy.
Can you give like maybe an example? I know we all know we've studied premenopausal, there will be a lot of symptoms, some of them can be considered for hormone therapy. But what are the cases that are like the kind of cases that's suitable for BHRT?
Okay, so if you're talking about postmenopausal women, right, they do suffer a lot of, some of them has got symptoms like hot flushes, and then they have migraines, or they have vaginal dryness. These are the common symptoms that women suffer due to postmenopausal. So, and also one common symptom is that they cannot sleep at night. That's one common symptoms in postmenopausal women. So for this kind of symptoms, and if the doctor have already tried other ways and it's not really working to resolve the issues, the doctors can always prescribe hormones like, progesterone to help them. Progesterone is a safer option compared to estrogen therapy. So they can actually prescribe progesterone to help them with their hot flushes or maybe with their sleep problem and see how that works for them. And then once you give hormone, doctors will need to monitor the patient constantly, usually in 3 monthly once, and see how they respond to the hormones.
Okay, what about people with insomnia? I know some people are taking melatonin. Is this considered part of the hormone treatments?
Yeah, you can also take melatonin, but in some cases, even after the postmenopausal women take melatonin, it does not work. And then when upon blood readings, we check that their progesterone levels are actually very low, and progesterone does interfere with your sleep cycle. So if the melatonin is not working for them, maybe you can try progesterone, or you can even try a combination of melatonin and progesterone. It all depends on the doctor's judgment on the patient.
Okay, so if for a GP who wants to start implementing this in their clinic, what's the first few steps that they can take to get started on this?
Okay, so the first few steps is definitely on educating yourself. So you need to know, GP needs to educate themselves a little about what compounding or what compounding does, what kind of services we provide. If they are unsure, they can always collaborate with the compounding pharmacy and talk to them and see what kind of services we provide and how we can actually help them in their incorporating compounding into their business. So that's one. Secondly is that you need to assess or identify your candidates for compounding. So just say a GP, like I mentioned earlier, they have a pool of patients who regularly come to their clinic. Maybe the GP doctor is good with just say older patient, right? So they have this pool of older patient who comes to their clinic and they always ask for something to improve their well-being, and but then they have problem like swallowing capsules or tablets. GPs can actually identify this and come to the compounding and tell us like how can we help to formulate something that will help with this pool of patients. So if they have trouble swallowing capsules, maybe we can suggest them a different dosage form, probably in a liquid form or a powder form. So that's one way. And then another way is integrating compounding into, their specialty care, like they can incorporate BHRT or even for skin problems, dermatology, right? So there's a lot of creams that outside that they cannot get. So if the GPs are always getting patient with a skin problem, they can identify the issues and come to us and tell us like, can you formulate something maybe for melasma, and this the combination that I want. So this is something that you can consider doing before you starting off compounding.
Okay, so what does Pharma Medica do and what do you provide for GPs?
So, Pharma Medica is compounding pharmacy. We create customized formulation based on doctor's prescription for a patient's special requirements. So, whether it's allergy-free ingredients or even what is this, a different dosage form, we're able to make them for you. So we usually get prescription from doctors who say that this patient has got certain needs in their supplementation or in their medication. Can you make this for us? So these are the services that we provide. We also provide a service where any medicine that is off the market, but it was in the market and patient has been taking it and they took it off of the market due to lack of demand, but the patient requires that medicine. If you're able to compound it, we can make that for the patient. And then we also can compound medicine that are certain patient may be allergic to certain ingredients in the medication, maybe due to the preservative or due to the ingredient itself. So, but they require that particular combination. So we can actually compound for them that without adding any preservative and also removing what is causing them the allergy. So this is what compounding pharmacy can do. And in Pharma Medica, this is what we do as well.
Okay, so as we wrap up, what is the one key takeaway you want GP to remember about this topic?
Well, for GPs, compounding actually offers a range of opportunities to tailor treatment plans, the unique needs of individual patients. So, by educating yourself or forming collaborations or partnership with a compounding pharmacy and incorporating customized medication into your practices, GP can actually enhance patient outcome, expand their treatment options, and also differentiate their practice in a competitive healthcare landscape. Because, when you open a GP clinic, you always need to have a USP. So incorporating compounding into your practice would actually be a USP for your business itself. And in a way, it also can help you in your long-term revenue or the income in your clinic.
I think that's actually very powerful. Just for those that don't understand USP, it means unique selling point. So what makes you stand out from the sea of clinics that is probably in the same role as you? So, because a lot of GPs are struggling to stand out. They
Yeah,
are
True.
all dealing with cough, cold, flu, and pretty much the same thing. And with the chain clinics and so many things coming up, I guess it's very difficult to stand out. But if you provide compounding medication, then you can actually help tailor make your treatment for the patient. And that is pretty much what precision medicine is.
Yep, true.
Okay, well, thank you, Kamini, for sharing. Those of you who are listening, if you're interested to find out more about Pharma Medica, be sure to click the link below. Kamini and Pharma Medica will be at Disruptive Doctors Conference this 20th and 21st September in Sime Darby Convention Center, so do come and check out their booth. And until then, I'm Dr. Selena. Keep disrupting the norm. Thank you.
Thank you so much, Selena.
Join Disruptive Doctors. Oh, oh, Disruptive Doctors. Impact